Welcome back to the Ahima workshop, the ongoing section on FIGHT. We're now discussing infections. Approximately 15 of 57 million deaths, that would be over 25%, are people who are dying directly as a result of infectious disease. And yet no one actually pays any attention because infection could be fungal, bacterial, viral, parasitic, and across the board, because there's no simple cure. In general, you don't get diagnosed. The big idea that might beat cancer is a very amazing story. There are viruses now, as well as parasites, that are directly behind many of the cancers. And the book that Paul Ewald wrote, saying infections are responsible for 4/5 of all cancer, and we have the tools to prevent them. So, as an expert at oxidative medicine, I, along with Dr. Robert Rowan and others, teach doctors how to do ultraviolet blood irradiation, ideally combining that with ozone, or even just combining that with H2O2 given intravenously, or even using ozone rectally, or even using ozone transcutaneously as a bag, or ozone saunas. Across the board, there is a time in our lives when we need to get rid of the junk we accumulate. And if you take DDT and you want to break it down to DDE on its way to CO2 and water, you will need oxidation, which is why if I put you in a hyperbaric chamber, I help so many things. You take people who don't know their family, you put them in a hyperbaric chamber, 3 or 4 treatments, they can be often good for running their business for another year instead of being put in an old folks home. So it's important to understand that there's reasons for this, but we're often not connecting the dots. It's too expensive, actually, as I point out, $5,000 to know which toxins are in you. And since we all have DDT, and since any oxidative therapy is going to make DDT less toxic, as everything can, over time, go back to CO2 and water, if I get you better, do I prove that it was an infection, or maybe it was just that my oxidative treatment treated your toxicity? And since it's very expensive to find out which kind of hepatitis do you have, because we have an epidemic now of non-alcoholic hepatitis across the whole nation. We have all of these conditions that are related then to infections that nobody is really diagnosing unless you go to high-level meetings, and that puts you outside of the realm of general medicine because you're getting into things. But if we understand that we can identify the virus that triggers cancer, we can work to prevent their transmission and force them to evolve from a fatal scourge into a mere nuisance. So how do we keep your body, keeping infections under control? Viral, bacteria, have been with us forever. But it's not that we need to throw a bomb at all of them and try to blow them up. We have to bring some balance to the system so they're not running our lives for us. And of course, that's only done when you start to have your body operating optimally. And you can't do that without improving all of your lifestyle. You're going to have to learn the exercise. You're going to have to learn all of it. But the direct toll of these infectious diseases is quite powerful, because now we can take atherosclerosis or take Alzheimer's, cancer, we can take any of these. We actually have an infection now that's proven to be involved in obesity. University of Wisconsin. Unbelievable. So if you understand the plaque in every human being will have in it cytomegalic virus. And if you understand that when you're talking about Alzheimer's, the plaque always will have some of these infections. But since nobody seems to want to cover the whole waterfront of FIGHT, most people are looking for a drug so grandpa doesn't have to go to the old folks home. And it helps a lot if we can actually get into this aspect of the causes. So, prostate cancer, the new big thing that we're finding in prostate cancer is XMRV. So this is a virus known to cause cancer in animals, and it's one that they're not talking a lot about. There's high-level conferences going on, and it's real. So just understand that even though you haven't learned about it, it's very real, costs money. The problem is developing tests for things that are important, as knowledge is doubling now every 2 years. So whatever you thought you knew, if you didn't go to a meeting for a year, you're 50% off base. And it's very hard to keep up. But if we understand that researchers at the University of Utah and Columbia have found this virus in more than a quarter of the prostate cancer tissues, so who cares? If it's kind of one more of these AIDS-like diseases, and it's only been identified, who's got the treatment? Well, that you will see as we get into this lecture. There's ways of dealing with everything, but now you need to know that because our whole country is not just pre-diabetic, obese, hypertensive, our whole country is tired. Fatigue is a big one, and we now can tie this fatigue to this XMRV. So what are we going to do to lower your titer? Well, if you have AIDS, I am an expert at dealing with AIDS because my friend Dr. Cathcart in Northern California treated all of the AIDS patients with just vitamin C. That's why it was so important to me to find a way to make vitamin C that would be a vitamin C delivery system so I could get higher blood levels and have a way to prove it. So we want now to have everybody know that they can test with a little strip of paper that has a green color on the strip. And if you wet it with urine, as long as you can get it to go over to a yellow color within a minute, it means you have 100 milligrams of vitamin C in that urine coming out your body, which means you have a high level of C in your blood. So when I get you to read the book, Curing the Incurable, with 1,200 published references, you'd understand why I don't feel afraid to live in a world that doesn't have vaccinations. Because there isn't any of the infections they're vaccinating you against that didn't provably respond without question when you gave adequate levels of C, and now that we have a friendly form, stomach friendly, that's well absorbed, and it's a delivery system with methylation support, so it gets into the cell, you can do magic with vitamin C. So, that would be one way. Of course, we have silver, and silver is a great story, or I have my infection protocol I've always used. Since as a doctor I've learned the more antibiotics you give, the sicker the patient becomes over time. They've even tied the excessive use of antibiotics to breast cancer. And we certainly see the excessive use of antibiotics directly contributing to the autism spectrum disorders. So, what do I do with these infections? Well, we know that these oral pathogens are another whole dimension. When I take a dead body that falls to the floor right now, and he's just had a fatal heart attack, if we take and cut the body open pretty fast and do the autopsy, we will be able to see exactly what happened. And that's a clot formed right after a plaque broke open like a pimple on your nose breaks open. And when the plaque broke open, it was because the infection had smoldered enough that it came to a head. Now that's going to happen in anybody, which is why my basic beyond chelation was designed to keep anybody from allowing a plaque, when it breaks, to cause a clot that can kill you. So I have everybody on natural blood thinners like omega-3 and garlic, but the oral EDTA, the different things that I do. But all of this is tied to this idea of what can I do, because periodontitis is clearly raising cardiovascular risk. And when that guy drops dead, often, almost invariably, you can find an organism in the patient's mouth that is also growing in the plaque that just killed him. So you need to be able to understand that we know a lot about this plaque today. There's lots of money going into research, kind of hard to keep up on it all. And I'm not going to have all of you go out and become really involved in actinomycetocomatase, but I'm just going to have you know that whatever's in the mouth, we can't even identify everything that's in the mouth. We can't even give you a name for everything that grows in the intestine of these children. But it's totally disrupted, I can assure you, from healthy children. So, periodontal disease, what are you going to do about that? Well, you could be brushing with peroxide, baking soda, whatever you're doing. But because I'm so concerned about the levels of all my total body burden of all these pathogens, I wind up using a lot of silver. And so I prefer, and silver, I'll get into some slides later, will accumulate in your tissues. And there's some people saying, gee, Dr. Gordon, you're against lead, mercury, and cadmium, arsenic. Don't you think silver is just one more metal? And I said, yeah, it's one more metal. But there's good evidence that it is essential and does actually good things. So yes, as having been the director of the largest laboratory in the world, with offices in Tokyo, Amsterdam, Boston, San Francisco, of hair analysis, mineral lab, I sold it to Doctors Data. So I've done a couple 100,000 people's urine, blood, and hair, and I do know a lot about this field. And so I can tell you that silver to me is a good guy, but it will show up more in my hair because I'm taking it and I'm swishing it through my teeth for a good minute and a half, twice a day, so I cut down some of this contribution. But then when I swallow it, it is not so smart that some people selling silver would sit there and lie to you and say, oh, it's such a smart silver, it doesn't kill any of the good guys. Nonsense. It kills everything. I've met with Dr. Robertson, director at BYU of the infectious disease department, MD, PhD, and he shows you that silver that I am using kills everything, including Ebola and prions. So please don't tell me that silver isn't going to kill the good guy. I just take the good guys, along with my fiber, well apart from the silver that I get, which I'm trying to do to control the body's burden of pathogens. So exploring the link in cardiovascular disease, the leading cause of death is still CV disease. Yet, how many doctors at cardiovascular, all they do is preach this nonsense of cholesterol. Cholesterol is a good guy. It's the main ingredient in my membrane of my cell. It's the main building block for all my steroid chemistry. It's why I might still not need, I don't have a Viagra deficiency because I can still make things like testosterone. I can make I can make the needed steroids that I need because I'm not driving cholesterol to zero, because that's not the answer for health. It's the biggest myth ever going. And when we can wake people up, but they've been so ingrained that they think cholesterol is the enemy, that the only way I'll be able to rescue these poor people who've been suckered into using toxic drugs like statins that are so toxic that they're actually, the benefit-risk ratio is so negative that no one should be taking it, in spite of all their nonsense. The only thing it does is it lowers the inflammation marker, like C-reactive protein. Well, C-reactive protein is partly inflammation, which when we were young, that inflammation meant redness, swelling, pain, and edema. And across the board, what you've got when you have any infection is you've got more inflammation. So if I'm lowering how many pathogens are having reproductive in my body, how much candida is growing, how much cytomegalic virus, I can actually, with chlamydia. Chlamydia is in everybody's heart disease today. It's in all the sexually active youngsters, they all carry chlamydia. So what can we do? Well, we know the inflammation, which is a good test, C-reactive. Now, why do I need tests? Well, I need tests because it's crazy to tell a patient that I want you taking anything like what I take. I take 37 different supplements twice a day. I am so expensive to keep alive that most people should just let me go, let me die. Because I wouldn't function without these, because I have significant underlying genetic problems, which we'll get into. But if I'm going to have you practice really good medicine, I have to make you able to understand that there is these infections, and they are much closer to the truth by far than the so-called cholesterol hypothesis. And yet, only in Germany and Russia do we have a doctor doing ozone on every corner. And ultraviolet blood it came from America. Ultraviolet blood, where we take your blood out and run it past a light that's a bright light of ultraviolet, and then we take it out and we put it back through so that it carries that energy. Ultraviolet always was an easy way to keep the school classrooms from infecting all the other kids. But I mean, this is so simple, but we're not doing it. And so these inflammatory markers, fibrinogen, that's why I'm teaching you that I have everybody on Beyond Chelation, because of the simple idea. Fibrinogen, when it's high, means you're going to clot faster. And remember, everybody has plaque. By age 21, every autopsy we do shows plaque. So you all have arteriosclerosis, big deal. We even have it in Egyptian mummies. So it wasn't necessary that plaque led to instant deaths. Instant deaths is another problem. There's the sudden death that you have when you have an electrical failure in the system, and that's tied to minerals. So always know when the people's heart is skipping beats, it's magnesium deficiency, which you can learn a lot about. Just doing red blood cell magnesium is one way, or we can do a test where we scrape the tongue like a tongue depressor, and then we put it on a slide, and we take an X-ray fluorescent detector combined with electron microscope, and I look at intracellular magnesium. I'm an expert at that. I can save lives, because nobody has enough magnesium. Just like with all the mercury in our water, food, and air, nobody has enough selenium. Just like with all the fluoride in all of our water, food, and air, and bromine in our bread, nobody has enough iodine. So I can tie these things in a way that you may be able to see why doctors in nutritional medicine get involved in all these things. But now we're looking at infection. And amazingly enough, systemic lupus, which has kind of become an epidemic, we have so much autoimmune disease. That's really why I wrote the whole thing and developed my FIGHD, was one thing: to stop autoimmune disease. If you read the book, The Autoimmune Epidemic, by Donna Jackson Nakazawa, her book will tell you that at Johns Hopkins, where she twice was hospitalized, twice, with total paralysis, Guillain-Barré, autoimmune. Now today I can treat that with pulsed electromagnetic field and take a patient who's been in a wheelchair for 9 years and in 2 months have them walking into church. I have to tie into your mind now the need for understanding climate change, earth change, magnitude. But anyhow, we're trying to get the picture in your mind that we have Borrelia burgdorferi, we have everybody fascinated about Lyme. They are all just panicked. I've changed the word from Lyme to Lyme's. Lowered immune metabolic encephalopathy syndrome, LIMES. That's kind of, remember, how did the British Navy get so powerful? Because they put lime on the ship and the men didn't die of scurvy so they could beat the enemy? So I'm going to teach you my limes. Lowered immune metabolic encephalopathy syndrome. This is another form, folks, of AIDS. And so if you understand that these poor people are running around from doctor to doctor saying, oh, I think my joint, I got bit, I know that I got Lyme. And the doctor does all these stupid tests. And then everybody else disagrees and says, oh, that's not Lyme, or you didn't have the right thing, or this isn't, or we're going to keep you on antibiotic for 6 months. What nonsense, nonsense. You don't cure anything by just hitting the bugs. You hit FIGHD. Or if you go to Mark's book, Institute for Functional Medicine, Mark Hyman, you'll have 7 keys. But you never do anything by just bombarding and throwing stuff to kill the Lyme. That's not where it's at, folks. Because lots of people get bit. And they don't all wind up with a bad joint bothering them for the next several years. So we have to treat the whole body. So arteriosclerosis is an underpinning in infectious disease and stroke. We're going to take a break. So if we look at this problem about infection burden, it's clearly part of the plaque instability. I don't mind you having plaque. I just don't want your plaque coming to a head like a pimple, because when it does, it exposes the passing platelets to the underlying layers below the intima, and that causes a tremendous reaction called clot formation, which is why I have everybody on gentle anti-clotting of some kind, garlic, omega-3, but that's part of what I call beyond chelation. So, cytomegalic virus. This is right out of Harvard, and Harvard is saying that about 99% of all adults have CMV. So why should I spend your money testing you for CMV? If 99% of you got it, and if you don't have that, you'll surely have chlamydia, and if you don't have that, clearly you'll have one of the other popular infections. So none of us are exempt from these things. Just like you cannot be on this planet without having tons of flame retardant, polybrominated diphenyl ether. You cannot live on the planet without having these things. So which is the, so you see the doctor, and one doctor says it's all the mercury. Forget it, it's never all one thing. And that's why you lead to a lot of dissatisfied patients, because I've had world famous people bring their autistic child to me and say, I know he'll be normal when all the mercury's out. And I said, do not believe that. That is not the answer. It is multifactorial. He will never be able to have normal ingestion of casein and wheat, and he's always going to need more magnesium than other people. He's going to have a lifetime fight to get the toxins out of his body. All of these are my approach. Don't focus on the little thing that you heard. Just because your neighbor says that they went to somebody and got chelation, and all of a sudden the kid talked, that is not the answer for the next door neighbor and even the next child in the family. Everything is always multifactorial. With CMV, by the age of 40, most of us have this. So you're going to do anything about it? Well, if we change the regulations so that more doctors will offer you ultraviolet with ozone, if I do that, ultraviolet blood irradiation with ozone, if I do that to you once every 6 months or even once a year, or a couple of times, I can drop your total body titer. I can provably take your AIDS titer of an AIDS patient and drop it around 98, 99% with about 4 of these treatments, and the same with hepatitis C, hepatitis B. So these are things that I know we can do. I didn't say cure. I dropped the titer to next to nothing. Once it's down low, my simple other programs keep it down low. So this is all part of the game. Now, this is Johnson & Johnson has been nice enough to develop a test that will actually tell us who's got cancer. And this is being used now at Sloan Kettering as well as at the Mass General. And when you read what it shows you, this test actually will find one cancer test out of 1 billion, and it'll stick on a little post. So 1 out of 1 billion will say. And what's interesting to me is that after men who've been lied to by their urologist who believes in yesterday's medicine, see, everybody is getting behind because knowledge is doubling every 2 years. So whatever specialist you see, he probably isn't giving the correct answer. That's why I ask you to listen to Dr. Radio. Because if I had concurrently, and I could have 2 screens going concurrently, I'd have the latest facts compared to the nonsense that you're paying money and being told by the leading medical center, so that we could move things into today's medicine, not practicing yesterday's. Because this test proves that prostate cancer is really a systemic disease, so why go to some idiot who says, I'm going to cut your prostate out and you'll be normal? It can't happen. Because if it's a systemic disease, you need to cut everything out, throw my whole body in the wastebasket. Because it is in my body, and this test proves it. So it kind of wakes you up then to this whole idea. Stray cancer cells in the blood says the tumor is spread, or is likely to. So it brings honesty to an out-of-control, completely nonsense form of cancer, which within 5 years we'll look back and say how barbaric burning, cutting, and poisoning has been. If you find out quickly that the drug that you're on is working, stay on it. But if it's not working, fire the doctor and do something else. This is good. You're going to be empowered patients. Now, I've been doing this for over 20 years, and the cancer test that I use in Tokyo by Dr. Kobayashi that anybody can find when you go to gordonresearch.com, and you put in the word cancer, up will come all the stuff that I can say, and FDA can't shut down. All the other stuff you have to join FACT and be a member of my health professional advanced school, because FDA is very unfriendly and doesn't like anything that challenges status quo medicine, because I have lots of bad things to say about every drug they give you, and my job is to get all my patients off of all of the drugs unless they fit in a narrow category of drugs that are actually going to have provable long-term benefits. Since I'm an anti-aging doctor and I'm only 76, I'm going to be on this stuff for another 30, 40 years. So I can't be taking things that aren't going to be useful for me long-term or for my patient. So if we're going to have you learn these things, you go to gordonresearch.com, put in a word cancer, read Kobayashi, and you will understand that I've been doing tests which are available to you right in Hollywood, Florida. It's called American Metabolic Testing Laboratories. Their website, caprofile.net. And they do a test, which we'll show you in a few moments. But this is the test now that is coming out of Johnson & Johnson. Gives it credibility because it's being done at Mass General. I've been doing these tests for years and been effectively able to save lives because the existing test costs you about $370 to measure 3 different ways of your HCG and a phosphohexoisomerase and a few other tests. We'll show you. Why do I like these tests so much? Well, think of it this way. All of my programs that I am involved with require you, the patient, to be deeply involved in changing your lifestyle, taking personal responsibility, changing your diet, doing the exercise, buying the supplements, and you're not going to do that unless you know that you have to. And the reason I was so successful in my practice is because 35 years ago, I was the only answer other than having your chest split open, so patients really listened to me. Now that I'm getting bored with heart disease, since I haven't had anybody die of a heart attack in over 30 years, I gotta find other areas, so I'm getting into cancer. And the cancer thing has been quite interesting because it's absolutely clear with Dr. Kobayashi that 10,000 patients, 10 years, not one died of cancer. They didn't have a clinical diagnosis of lump or bump when they came. But everybody has cancer all the time. So if you didn't have a clinical diagnosis, how did we keep you from ever getting a lump bump? We did a blood test once a year. And that blood test allowed us to know, uh-oh, Charlie, you're going to have to stop smoking because your test is going right straight toward cancer. Cancers in all people take an average of 7 years to become lump bump. And during that time, your blood test gets more and more bothersome. So bothersome test makes you, the patient, compliant, willing to do what I tell you to do. And when you're willing to do what I tell you to do, it becomes so boringly easy to stay healthy. But most of us have this attitude that we are indestructible, we can drive this body 100 miles an hour, 24/7, never have to give it sleep, never have to give it right nutrition. And so then finally when we burn out, then we expect some doctor's going to have a drug or surgery or something that's going to forgive the body for the way we've abused it. It doesn't work that way. So this test is going to let you become empowered, because now with Johnson & Johnson and Sloan Kettering and Mass General behind it, you'll believe it. This is the test I've been doing, E.K. Shandell. And in 25 years, we've never had a patient suddenly develop cancer and start dying on us, because that was what really humbled me when, you remember, I've practiced medicine now 53 years. I got into anti-aging 40 plus years ago. And so practicing in Sacramento, when a very important patient came to me, because I was an advisor to an institute of anti-aging, they wanted me on anti-aging, and that lady was quite young, about 40, and within the first year of life, she embarrassed me tremendously because she went absolutely into widespread metastatic malignant melanoma. Makes you really realize how humble you are as a doctor, because you can't look at every one of these spots, these little dark spots in your skin, and tell me which one is a malignant melanoma. We have people going to dermatologists every year, and they actually have a microscope they can put right on the lesion and try to tell you how suspicious that lesion is, but that's a tough way to treat it. I prefer, because that's only one of the cancers that kill you, but it really made me aware that you've got to know a lot if you're going to be an anti-aging doctor, because you're going to have to cover everything from hormones to all this stuff about cancer. So this test actually includes the phosphohexoisomerase. Nobody else is doing that in this country. One of the top drug companies, Japan, came over to learn how he's doing it, because this test tells you how much anaerobic metabolism is going on in your body, and Warburg got the Nobel Prize to show that cancer is an anaerobic process. So when this test goes up, I know that your body's doing bad things. Now my oral chelation is going to change the level of thickness to your blood, so that I'm going to have blood that is as thick as ketchup in some people, and I want your blood to be no thicker than wine. That's motor oil weight 80 down to motor oil weight 5. I want you thin, so I can get past obstructions, because everybody has some obstructions, some reasons that a part of your body doesn't get fed well. So that's not alone a total answer, but at least it's something that I do, because I have the side effect that with oral beyond chelation, I'm pushing bad things out while I'm putting good things in. But if we look then as these tests, the phosphohexoisomerase is going to be elevated in many conditions, but it's a good early warning that there's existing or developing cancer. Now the other tests are CA-125, 19.9, CEA, HCG, all forms of doing it, and PSA. These are tests that are actually useful to do. Now this is my buddy over in Tokyo, Dr. Kobayashi. He's the MD, PhD molecular biologist and oncologist and pathologist. So that's a lot of training. Now this guy has got to be both anal retentive and compulsive, because he has data on 10,000 patients. He's tested them. He actually tested them energetically, almost like our EAV testing that we do, the bold testing. And he has data on all these people. Now what he did for us is he found He's treated more than 20,000 early stage, and the early stage is so easy because we took people who mainly came because everybody in their family was dying of cancer. And we proved that by putting them on the program, we could know by the blood test if they were not doing enough, and we could add additional things. What did we do? Some heat treatments, far infrared, negative ion treatments. We did the tumor markers, and we would do some herbs, some massage, acupuncture, moxibustion across the board. You know, this is just amazing. He made the claim that holistic medicine will cure 70% of cancer patients. Holistic medicine. Now remember, he's a molecular biologist. That changes the game, folks. Because if you didn't have a degree in that, you're not speaking today's real medicine. You're like if you've never taken a course in quantum mechanics, you don't really understand the real world around you. So all of this is going to let you understand that this is the average tumor then that it starts here, but it takes 7 years to get to the lump bump. And when you're at the lump bump, that's when we finally tell you, oh yeah, you've got cancer. Well man, you had cancer all those previous years, but you didn't know it. And the net result is that early detection increases the likelihood that you're going to survive. So Dr. Kobayashi is clearly showing that cancer starts 7 years before the lump bump, and everybody is merely so surprised when all of a sudden they find that lump somewhere. But they had 7 years that this test would have told us with increasingly large numbers that they weren't doing enough with their lifestyle detoxification nutrition program. So it's pretty exciting to know that this is what's in his blood test, which is $500 when you're in Tokyo. Now, because the numbers have to be tight, when he does a CEA, there's a huge difference whether it's under 2.9 or over 4. Now that's a very tight number. Let me explain why I'm making a big deal out of this. I have flown him to Paris, and I've flown him to Emory University, and I'm trying to put this test into America. But because he is compulsive, he wants these tests to be plus or minus 5%. Most labs are happy with plus or minus 10%. He wants to be able to tell you to your face that you're getting in trouble because your test on your ferritin has started to move too much, or your test on your tissue plasma activator. So whatever test he's doing on you, he's got to be able to tell you, and then he takes the combination of all of them to give you an overall score. How close to serious cancer are you getting? Because this way, we know. Because Japanese are really amazingly compliant. The Japanese men will actually stop smoking when we tell them you're getting so close to the flame that you'll have a... We don't know if the tumor will be in your prostate or your brain. We don't know. We know it's growing. And the Japanese are so compliant they actually stop smoking. But the bad thing is, a year later, when the test is really good, they say, can I go back to smoking again now, doc? And obviously, they can't. So these tests, CA19-9, the heat-sensitive alkaline phosphatase, these tests are done by a compulsive oncologist, pathologist, molecular biologist, but we one day will have other labs doing it. However, it appears that molecular medicine is going to be able to ride on the research that he's got here and be able to know that they can do this one day now with just a simple drop of blood. It's going to go to that. Because he, as a crusader, Dr. Kobayashi has proven that it's all ties down to lifestyle, detoxification, and lowering stress. And so he would do his programs, and he would lower the risk by doing the combination thing. And when needed, we would use some herbs and other things to raise the immune system. But without exception, we were always able to turn things around. Now, American Metabolic Testing Laboratory, Hollywood, would love to do the big panel I just showed you. But he's been doing this test for over 15 years, and doctors who use it have been very happy. Why we've been happy? It has warned them who's got cancer and who doesn't. It really is a useful approach, because patients who were picked up very early, I did a very young lady, and her test came back abnormal here, and I immediately went and I did a whole panel of tests, and immediately she came back with CA125, suggesting she probably had early ovarian carcinoma, and she had no symptoms whatsoever. I probably saved her life because we were able to do these tests, and she failed the phosphohexoisomerase part of this panel that Dr. Chandel does in our country. Now, this is a new test that is actually available. It's called U-Test-U. And U-Test-U means they actually it's a molecular test. It only takes a drop. And you actually contact them. You go to a website and you put in the word you, test you, and you actually spend $150. And here's how accurate it is. On liver cancer, it picks up 96% sensitivity and 96% specificity. That's unparalleled. But it is terrible on prostate. So bad that they have to do a PSA. So there's no one test that's going to get every kind of cancer. But any kind of cancer test can alert you that you have a problem. And then we have time to change things. So if you look at this, this is what the Cancer Treatment Centers of America. It's run by Dick Stevenson. He's been my friend for 35 years. He has hospitals and facilities throughout all the United States. And he brings naturopaths in to work with the oncologists. So the patients actually get some nutritional therapy. And is there an advantage? Well, look at the numbers. In each case, SEER would be standard survival versus cancer treatment survival. So in every kind of cancer, getting the additional benefit of nutritional support as well as positive thinking and total support of the patient, look at the differences. Here you've got at the end of 3.5 years, if the patient came in advanced breast cancer, standard therapy, 29% of patients are alive. With cancer treatments, center, they're 42%, 13% higher. So you can see in the first year, they're 28% better. And if you take advanced prostate cancer, they're still, again, 20% better by adding additional modalities beyond what mainstream medicine is doing. I'm not saying that that's all you can do. I'm just giving you some facts that you can deal with. Now, Suzanne Summers wrote a really good book in which she takes some of my doctor friends like Brzezinski and some of the other doctors and writes up what they've been doing, including Dr. James Forsyth in Reno. And this book is an easy way to see what's out there and who's doing what. Now, Mark Rosenberg is a really bright doctor, oncology, who's lecturing at meetings of the, what we call A4M, the anti-aging group. And he gave a lecture recently showing that just bicarbonate, because we have a doctor in Italy who's been treating cancer with sodium bicarbonate. Now, he does it differently. He actually has to put a catheter. He used to be in radiology. So he puts a catheter right into the artery that's going to the cancer to bathe the cancer in the alkaline. This gentleman is merely pointing out that you see some alkalinizing, having some clear-cut ability when you do research on cutting down how many cancers metastasize. And these slides will show you that neutralizing the acid pH of tumors does inhibit invasion and hence it reduces how many spontaneous metastases you get. So sodium bicarbonate is never the total answer. No one thing ever is, but it's just useful information to you know that this shows that oral bicarbonate significantly reduced metastases in experimental models of breast and prostate. And is it doing this by cutting down circulating tumor cells? Well, we'll soon know, because there's much more research can be done. Now, I keep bringing up oxidative medicine. And here's a clinic that is actually advertising that it increases the delivery of oxygen to cells, stimulates the production of beneficial white cells, breaks down toxins. So when I'm talking oxidative, there's many things that are happening. And oxidative sounds so different than antioxidant. And it's just kind of like cholesterol has become so well imbued in the nation's consciousness that if you become a doctor of oxidative, especially those of us who use vitamin C to be an oxidizing treatment, it floors everybody because they say, wait a minute, I thought it was an antioxidant. It's all in how it's used. So the devil is always in the detail. And I want to make sure that all of you understand that I can give you enough IV vitamin C that I can overcome any kind of hepatitis. I can save your child's life. I have to make it very clear. One of our slides will show you a man that had been 22 days in coma. And the doctor team at the hospital came to the family and said, time has come to let Dad go. And the son's, 4 big strapping sons, says, Dad's going to have IV vitamin C before we let him go. And then we show him a picture running his tractor as he gets completely back to health. And no one will do that in this country unless you fight for your life. Because hospitals will tell you, we won't give IV. I mean, they'll give any crazy treatment that will kill you. If you read the toxicity of the drugs that are given to everybody, if you read the AMA admits that the drugs are the fourth leading cause of death in America. And Gary Null and I have looked at it, and that number is phony. They are the leading cause. Why do I say that? Well, because the AMA study that said that the drugs your doctor is giving you are just the fourth leading cause, that would mean right after heart attacks and strokes and cancer, that it's your doctor that's killing you. They only looked at the number of people who die in hospitals. I've seen some people have the nerve to die at home. So if you add that small group to the story, you're going to now know why. It is your job to understand that you've been seduced into a phony system of medicine that is absolutely what I want. If I get hit by a train, please give me all those drugs. If I'm just nothing but a piece of nearly dead meat, those drugs are what I need. Because short term, but we're all fighting the chronic degenerative diseases, aging, as well as the cancers and heart disease. So oxidative medicine is the good guy. And we've been able to get close to what I can do with the IV, but I can never duplicate. The IV gets past the fact that in general, if I give you 100 grams of vitamin C, which I have people that are able to take the C that I've developed as 100 grams in a day, but they're still only going to get about 30% of it because there's a lot that has to happen between the intestine and getting in your bloodstream. So if I can put the 100 grams right in your vein, I'm going to make a huge change. And it was 100 grams that took the nearly dead patient that they wanted to go ahead and let die. So you have to understand this oxidative stuff. And vitamin C is working through hydrogen peroxide. Nobody seems to understand that. That's why it's so sad that the oncologist tells everybody, whatever you do, don't go to one of those quack doctors and never give you any vitamin C. Because vitamin C is working in the oxidative, because radiation and chemo are all oxidative therapies. Essentially, we're all using the same science. It's just that we wish to do no harm first. It was part of the Hippocratic Oath that they may have forgotten. But if we look at how hydrogen peroxide works, when a cell, white cell, is going to release myeloperoxidases and kill and bleach to death a virus or a cancer cell, it is doing it through oxidation, and it's actually elaborating hydrogen peroxide. So it's totally natural. You have hydrogen peroxide. It's a key part of your body. Now I keep mentioning silver, and there are really lots of companies that are producing silver. This is a company that is, I believe, sold under the name Argentin, and they have been doing good work to explain what it can do. The biggest thing with silver is doctors, A, don't believe that it works, and if it does work, they're all afraid that you're going to turn blue and gray. And so they're worried about the toxicity versus the benefit. So I've put a couple of slides in to have you understand that there's a lot of data about silver today available, and we know the LD50 for silver salt, silver nitrate. This is silver nitrate, so I'll get into this thing. The LD50 for a colloid, the colloids that we're using is much safer than the old salts were, but then I'm going to go beyond that to have you know that some of these things, you'd have to take 7,500 teaspoons of the silver products that you buy in the store a day in order to get a toxic level. So I don't think too many people have the money to buy 7,500 teaspoons and drink that in a day. And even then, it's probably only some people have, but you're going to always have this fear about the blue color, argyria. Now, argyria is a benign, cosmetic bluish. So if you knew that, let's just say that you were dumb enough that you didn't know how to get the really good silver products, and the patient was making their own silver, and they didn't know what they're doing, and they're getting the wrong kind, and they could get argyrosis with some of the old silver salts, as we'll show you. The guy would be alive instead of dead with his infection in the morning. So you have to weigh that against the specific points of what is infection. So it becomes complicated. Where do you treat? So argyria is caused by silver salt. The salt species include the mineral salts, and that's not what... So here's the salts we're talking about. Silver chloride, silver nitrate. These are not what we are using. We're using these newer products. And now the problem becomes, are you going to stick it in the nose? Yes. Are you going to put it in a nebulizer? Yes. Are you going to stick it in an enema? Yes. Do you care where you stick it? No. Is it ever going to have anything negative? We have taken and taken humans that are near dead. We've taken a dog with necrotizing fasciitis that was in early renal failure, was within 4 hours of death, was comatose. And we've taken a turkey baster to baste the turkey, you know, in the kitchen, and we took the silver and we put it down the throat of the unconscious animal. And we have the picture, and we sprayed it all over the animal. And we've been able to show that the hair came back, everything came back. So we really understand that I don't care if it's a gastro, I don't care if we give it in the vein, I don't care if we stick it in your bladder, silver is useful to know about. Silver accelerates tissue healing, prevents scar tissue. Positive silver stimulates dedifferentiation and redifferentiation of stem cells. So what I'm saying to you is silver is really an essential nutrient. And because people don't know that, they don't use it. And if they don't use it, they need to understand that 100,000 alone die this year in hospitals of antibiotic-resistant infections. In a trip to a health food store with a good colloidal silver, and they drink the whole bottle. That night, the patient will still be awake and alive the next morning, so you could save a lot of lives. Silver reduces tissue inflammation. Silver helps the immune system work more and across the board. It increases the facility of the. So this is reactive oxygen species. So silver, actually, if you want to read how to make a spaceship in your backyard, you need to know how to make rocket fuel. How do you make rocket fuel? Well, you get hydrogen peroxide and you add silver. Because silver makes hydrogen peroxide into rocket fuel because it accelerates the oxidative capacity. So I have a lot of patients with ear infections. So I'm going to put the silver right in the ear. But I could have put peroxide if that's all they have in the house. Peroxide is going to be a weak form, but let's say I put in a little of the peroxide and then I add a little of the silver. Now I've got a huge, you can hear it bubbling in there, you can hear it explode as it starts to kill all of the infections in the ear, or the same in the mouth. So you can begin to see it. I really believe in oxidative. So it's safe, it has no functional toxicity, it's broad spectrum, and so this is important. The one that I've worked with came out of Provo, Utah, and at BYU, Dr. Robinson has found that the team he's been working with there is in fact so good that they've now made this into a disinfectant that can be used in the dentist's office and the doctor's office and the hospital, and they've actually made an advanced form that will kill anthrax spores. So let me tell you what that means. When the person sent the anthrax through the postal system, it cost us about $10 million to clean up that post office, and they closed our nation's capital for many days, and they had to use some toxic substances, fluoraldehyde, that are so toxic you have to be in a gas mask to be around it. We have made silver able to replace all of that, and we can sterilize all the equipment used in the hospital safely now using advanced silver solutions. So silver kills bacteria, and it helps the wounds to heal. It is used as a nutraceutical in late-stage cancer. And so this is important to understand, that when we start talking about cancer, more and more they find people are turning to alternatives to help fight their cancer. And supplements are going to be widely used, but the patients know what to get. What should I buy? They go in the store and there's so many choices. And so if we're going to have lifetime longevity, my friend Martin Dayton, practicing in Miami, has given an excellent lecture at the Anti-Aging Association, A4M, and anyone can buy these lectures. They're available from 1-800-NOW, N-O-W-TAPE, T-A-P-E, and if you bought this lecture, there would be many key parts that you'd find, but the chance that you as a man are going to have cancer in your lifetime is 44%, and you as a woman, 37%. Now, just taking one of the tips that he gives in his lecture, one tip alone, melatonin, widely available, cheap as dirt in our country, it's on prescription in other countries, but you can still get it. And if you see what actually the research on this melatonin is doing in doses of 20 milligrams, the survival rate is in metastatic breast cancer. Without melatonin was 24%, with melatonin was 63%. Do you think you'd be interested in learning more about melatonin? So it doesn't make any difference what the cancer is. You can talk about any of the different cancers, from glioblastoma, who had zero survival, 23%. So I think that maybe this is one tip from one doctor to another about a naturally occurring hormone that's marketed in our country and it's recognized for many of its benefits. So now you can get into this fight. Should an antioxidant be given when you're getting cancer therapy? And there's been such passion on both sides of this. And I have really lost a key phone call when a gentleman from NIH, whose father was getting radiation therapy for his cancer, and he treated his father, and he was in the Department of Radiation Research. He treated his father with antioxidants. And his father didn't get sick like all the other patients. And his father said, "Son, I'll probably be the only one that dies because you gave him a wild idea. You gave me the antioxidants while I'm on radiation." His father was the only one that lived out of the whole group he was treated with. And I never got to put him on ACAM when I was program chairman for 10 years to share this knowledge. But you all need to know that whether it's radiotherapy or chemotherapy, the balance of evidence is absolutely overwhelming that you are far safer, and this is just one of the literature reviews, but it's so difficult to fight status quo medicine because they absolutely still believe what they do. And now you have Newsweek joining the fray, telling everybody, "Oh, antioxidants are dangerous, you shouldn't even be on them." And so these are disgraceful things that if you realize how big is our competitor. Our competitor is Big Pharma and mainstream medicine. So if they are that big, obviously they're going to always obfuscate the public any way they can. Victor Herbert is a now deceased person that I always fought with for years. He was the voice of the AMA against alternative medicine. And he lied. He actually published a paper that vitamin C destroyed B12. And he got that published in mainstream medicine. And you can know that a large number of people started to die the next week because they believed this lying researcher who's been a top voice against alternative medicine, now fortunately deceased, because he actually was shown to never have a reproducible study. No one ever again found that vitamin C destroyed B12. But he got it published in mainstream. They will do anything, just like they will try to tell you if they have one child with a headache in an emergency room, they'll publish a paper. This child came in and his mother was giving him vitamin A. Clearly the mother is killing this poor child. And they will publish, those are called case reports. They'll publish that. But if I would publish the World Health Organization study, that youngsters given 200,000 units of vitamin A don't die with acute childhood diseases that otherwise die, do you think anybody's going to bother to publish that? No, we're too busy telling everybody that this is all nonsense, that it doesn't work. And so my standard approach for infections has always been high doses of garlic, the kind that didn't stink. I like it from Japan. The kyolic liquid. I could treat pneumonia with 2 bottles of liquid garlic alone. And I didn't use antibiotics 99% of the time. So it's important to know how much C did I use. It had to be a lot. And obviously if I could get the IV form, it helped a lot because you can only get so much from the oral. But I can still change things now that I got silver. And I can always use the garlic. And then I will use in a typical adult, 180 pounds, I can take safely 500,000 units of vitamin A a day for 5, 6, 7 days, and 1 out of 100 will get a headache. Now that's a terrible side effect to save your life, but I think it might be one that we can put up with. And so it stops when you stop taking the A. So it does increase intracranial pressure on a few people, but it has no long-term side effect. Now let's talk about vitamin K3. K3 has got nothing to do with K2. K2 has changed my life. As the father of chelation therapy in this world, I'm the one that wrote the protocol that's treated 10 million people. I'm the one that wrote the protocol that Uncle Sam is paying $29 million to do the trial to assess chelation therapy. That's my protocol. It's not what I do anymore because I wrote that protocol 35 years ago and I've gone a little bit beyond that. And I needed in those days a 3-hour treatment with sodium EDTA that would grab your calcium, make it unavailable in your bloodstream, so your body had to adapt to the fact that I was grabbing calcium and turn up your parathyroid which would mobilize all the calcium on your arteries, and everybody at age 80 has 140 times more calcium in your blood vessels than you had at age 10. Everybody turns to stone unless you're on enough magnesium to tame the calcium. Never take calcium without same amount of magnesium. And don't do any of it without K2. K2 has nothing to do with K3. If you go to the University of Maastricht and you start learning about vitamin K, it has got K1, K2, K3, and they all do entirely different things. But K3 has the chance of helping vitamin C do more oxidative, just like silver makes vitamin C more oxidative or peroxide. So if I really want a hot fire, if I want to burn all of the cancer, all of the infection in your body, remember they're almost the same, cancer and infection, and I want to burn all the toxins, remember they're all the same, then I need enough oxidation to have a big bonfire so that you have less DDT, less of the cytomegalic, less of the various chlamydia, and less of the cancer cell. And I can't do that without a fire. I need a bonfire. But just like you put the fire in your house, you're not afraid to have a fire, but you keep it in the furnace. So you need to know how do you keep it down so that I'm not just burning down the house. And that's learning the details. Is always, the devil of all this is in the details. But K3 is going to let you learn how to do much more than we can do with just vitamin C. And it even works just by mouth. But I have so many people that I can't trust to absorb things. We have people coming in who are taking lots of vitamin D, but they don't absorb anything anymore. What is vitamin D? Well, it's essential. How many people are low? 99%. How much does an adult need? Maybe 5,000. But it's a fat-soluble vitamin. ADEK. Fat-soluble. Now, did somebody take out the lady's gallbladder? Did they tell her without the gallbladder she may not have the ability to absorb the fat-soluble nutrients? Did anybody tell her that they could go to the store, get standard process, and find some bile salts and actually take bile with her meal so she could use the fat-soluble nutrients? Little details in medicine. That's why it's all detective stories. So if we're going to get vitamin C with K3, we'll generate H2O2, and H2O2 is my good guy. Now if I put H2O2 in your vein, I can save your life. I've had 80 H2O2 in my vein. It took 10 years before the vein came back. So there's no catalase in my vein to protect against. But I took 80 of them because I needed help. The big turning points in my life was on the 8th chelation. For the first time, I, having come on this earth with many genetic problems, never able to participate in sports, never able to have any, I wasn't allowed to think because my heart was so weak. On the 8th chelation, I could run directly up a mountain, 2,000-foot elevation, 2 miles, and my Irish setter, who was 2 years of age, was ready to give up, and that was the 8th chelation. The next big wake-up call was when I went to Germany and I studied ozone and ultraviolet, and I took one of those treatments, and the next morning I woke up like I was reborn because I'd lowered all the infections that I didn't even know 20 years ago that all these infections were in us. And none of you know you've got them, and none of your doctors are diagnosing it. So preventively, we should all be learning this stuff. And if you had the money, you would find a doctor, even if you had to fly to Germany and Russia, where we give you ultraviolet and ozone on every street corner, and you'd get some of these treatments that would really change your life, because it's all part of this H2O2. I don't like to use H2O2 in the vein anymore, because this country is so fouled up that 60 Minutes did a hatchet job on Dr. Short, who was trained by me to use peroxide correctly in the vein, did it exactly correctly, saw a patient with peroxide on Wednesday. The patient on Friday saw her MD, was given a very toxic drug for her MS. On Saturday, she goes into all the side effects listed with the drug she had, but they took it nationwide and said it was the doctor on Wednesday giving the peroxide that killed the patient. So because of that, we may have lost peroxide for the American population. So I'm sorry, but I can teach you that getting 100 grams of vitamin C is another answer to getting H2O2. And if I give it to you with some silver, even by mouth. You see, when I do ultraviolet blood and ozone, by taking the blood out of my arm, run it past the lamp, then add the ozone, put it back in. If I then drink at least an ounce out of a 2-ounce bottle, it'd be half the bottle of silver. That's 150 sprays. If I do that, I can have a Herxheimer all night long. What is Herxheimer? It means I'm going to have a high fever, I'm going to have shake and chills because I kill off so many organisms. When I really raise the power of the fire, that I will wind up. But it was that proof when I was in Germany studying the ultraviolet blood ozone that it was lowering toxins in my body. And remember, I had 2 hyperbaric chambers costing $110,000 a piece. The Nautilus chambers allow me to deal with somebody who's had a stroke and have them come back in one day and have them walking, signing the paper, etc. in one day. Adding to that the electricity and adding when I have to do magic. The patients in my little 17,000 square foot clinic in Sacramento with 60 employees, with my overhead of $10,000 a day, I could take the patient with impossible condition and I could put them on the colonic with ozone. So I took out everything that's in the gut that was not good, and everybody has a lot of stuff that's not good. And that means that for the day, the liver said, my God, I have no work to do because there wasn't any poison coming up to the liver. So I gave the liver the day off so it could start to repair itself. Then I could start to do some intravenous feeding that day, and now with the body ever ready to go, I could put a patient in my hyperbaric chamber. Now all the cells are alive and they have oxygen and energy. Then I could add the physical modalities like electricity and magnetism, and I could go and do what I have seen save a patient's life who's in coma. What did I do that saved a life that was in coma? Well, the lady was applying for a job at my office, and she wanted to leave the cardiologist in town because she thought they were killing people. She had heard about the great work of chelation. And I said, when you leave them, they will blacklist you in this town of Sacramento. So I said, you spend a day at my office to make sure that this is what you should be doing. So I have 60 employees, I'm busy seeing patients, and suddenly I'm called, and she had had a headache, and she told somebody she had a headache, and we don't carry aspirin in my clinic because I don't use aspirin, I use natural garlic, omega-3. So she wound up suddenly collapsing. And the staff of mine put her in a room, so she's in a recliner chair, and she's obtunded. By the time they find me which room and I get there to see her, that means she's not breathing, her eyes are dilated, and it's not a good picture. And having been that she's the nurse for the leading cardiology group in town, I didn't want to have her dead in my clinic, so it was a good idea if I could bring her back to life. And so knowing, as I do a lot about these things, I knew that when you stop breathing, shortly you will have no ATP in the cells. And when there's no ATP, you can't pump the calcium out, so that there's 10,000 times more calcium outside of an average cell than there is inside the cell. So that's when death starts to occur, because I'd seen death on the electron microscope, so I understand death at this level, the microscopic level. So immediately I gave my sodium EDTA. This was one time I would use sodium. Now I only use calcium EDTA because it's a 3-minute chelation instead of the 3-hour, because I don't need the 3-hour because I have vitamin K2, and I can treat the calcification of the vessels without my old 3-hour treatment, which the doctors are resisting change because everybody resists change. Even the chelation doctors want to stay in the past. But so now I've got the patient, and I put in the sodium EDTA. And of course, if somebody is suddenly obtunded in your office, that's sudden death. Now, if it seems to be more brain-related, then you have to make a calculated choice. Is this a bleed or is this a clot? Now, the numbers happen to be, because I know these numbers, because I defend doctors in court all the time, having been the co-founder of ACAM, when anybody gets in trouble with chelation, I have to defend them, so I've been in many, many courts. I've been in probably in front of 30 medical boards, telling them that I would sue them for illegal restraint of trade if they don't leave my doctor members alone, because we have rights too. There can be a minority opinion in this country. We don't all have to practice the same medicine. So knowing this, I have the lady, and I start the disodium EDTA. And I make that choice that she's 70% I'm right, 30% I'm wrong, because if I'm wrong, I'll kill her faster. So I gave the heparin with the disodium EDTA, so this way I was protecting. But at the same time, I was doing all this, but this is somebody who's just applied for a job. And I have the staff going through first, trying to find out how they can call a husband, see which hospital you go to, because I was on staff of both the hospitals in town, but we wanted to know where they would prefer, but I was hoping to stall for a little bit of time so I might save her life. And so she happened to be sitting next to a chair where I had my electrical instruments, because I've been in electrical medicine for a long time, like like trans-cerebral electrical stimulation with various devices, the alpha stim. There's many things out there that you can hook on this there, that here, internal loads, and see a tremendous change in behavior. Because I really believe in the energy of medicine and the physics of medicine, and there's a reason that I'm now teaching everybody about pulsed magnetic field therapy and using static magnets. But in any event, what was quite profound is this obtunded person with dilated pupils, unresponsive. When I put ear to ear and I turned on that little machine, instantly she was alive and talking to me. Now, since this was a chance for me to learn, I wanted to be sure it wasn't coincidence, so I turned it off and instantly she was gone. So I turned it back on while I kept the treatment going. But this is the most astonishing case. We admitted her to the Sutter Hospital in Sacramento, and she was in less than 72 hours. Remember, she'd massive brainstem stroke. She'd knocked out the respiratory section. She was blind and unable to breathe. She was totally recovered in 72 hours, had full recovery of everything. They've never seen anything like it at the hospital. She came into my office a few weeks later and said, "I guess you saved my life." And I said, "Probably." And she said, "I guess you're probably not free to talk about it." I said, "You're right." And so in any event, so that was kind of interesting to know that when you understand all these things, they all fit together. In vitamins versus chemotherapy, this is really a simple program. My mentor, when I changed my life and stopped practicing the mainstream medicine that everybody else is stuck on, I went to a meeting in which Dr. Emanuel Sharaskin, he is MD, DDS. He's written all the books on predictive and preventive medicine. One of my many mentors, Dr. Abraham Hoffer, and Dr. Lennis Pauling was present, and Dr. John Miller. He was the head of research for Rohrig and Pfizer, first one to ever put a mineral into a vitamin in the history of the world. And he became my mentor, and with his input, it led me to do the first hair analysis ever done. I was one of the first people to have the hair to see how low my magnesium and mercury, and then I became the director of what became the largest lab in the world, which we later sold to Doctors Data. So there's a little background. But out of that one meeting, when I left that meeting of a metabolic medical association that had these different doctors speaking, and I went back to the hospital, Sutter General in Sacramento, where I always had 8 patients in the hospital all the time, a huge practice, and I had left, been at that meeting, I came back, and the one lady had been so depressed that I had really given up and was ready to start electroshock therapy. I thought I could really practice pretty good medicine. But she was the wife of the commanding guy at the Air Force Base. And and we were ready to start shock therapy. When I got back, because of the meeting I attended, I ordered in the hospital her 5-hour glucose tolerance test. And her blood sugar dropped to 30 while she's in the hospital. I changed her diet and treated her as we did, and in 2 days I discharged her after she'd been under treatment by myself and the head of the Department of Psychiatry for 4 months. So that was one room. Then I went to the next room where I'd taken the lady's gallbladder out, and it had never healed up, and the wound was just seeping fluid. She'd been there for a month, and it was just there. And so I remembered the next lecture I had just attended, and I gave her zinc, and in about 3 days that wound went like that, closed up. And so you could see that in one simple thing, I went from one of the busiest doctors in the hospital to one who didn't need the hospital. And my average census went from 8 patients a day to less than admitting 2 patients a year as a result of practicing this kind of medicine. I simply call it advanced medicine, but it's the real medicine. So this is my friend, Dr. Abraham Hoffer, MD, PhD, one of the first ones to do actual double-blind studies on the treatment of schizophrenia. He treated me, and he trained me, and I saw every case of mental disease in Northern California, and I did on them the tests that we do at the Princeton Brain Biocenter, where we teach you about cryptopyrrole and histamine and levels of copper and things that you don't know about, but I do know, and it's amazing. But this was his simple program. What would he do on cancer patients? And his book is quite profound. High-dose vitamin C is safe. That's a big thing. I'm now training doctors in Japan. We have a huge number of doctors flying over to the Reardon Clinic in Wichita, Kansas, where we specialize in the treatment of cancer with vitamin C. And they have learned to use what we call the bright spot test and test the urine on the patient to make sure patients are compliant, and they always test the urine 24/7 when they go home. They have to pee on a strip of paper and always get it to the yellow color, which gets them to not buy cheap vitamin C and not to go off vitamin C, because to get the yellow color, most vitamin C won't get that color, which is the higher the level of C, the longer the patient lives. So there's a lot to learn about these things. So in anything that you read on these slides. Terminal cancer patients getting 10 to 60 grams for 8 weeks, et cetera, et cetera. When you look at the research that Linus Pauling wrote the book about vitamin C in cancer, we always started out giving the IV vitamin C, because that way it's 100% absorbed. And by oral, you're only getting 30% absorbed no matter what you do. I do have a friend that has been able to show that it's uniquely taken up intracellularly, because I do it with methylation support, which we'll explain later. But it's important to understand that vitamin C actually is killing tumors, and it's amazing to see that this actually comes out of NIH. National Institutes of Health. It actually has the research going on high-dose vitamin C. And it's kind of important to me, this is all the work coming right on Mark Levine, and you can see these across the board in the laboratory on 43 cancers. The research that high concentration C had anti-cancer effects in 75% of the cancer cell lines and always spared the normal things. They showed that these levels could be achieved in people. Do you think our country is studying this stuff? It's unbelievable that they actually ostracized Mark Levine, who started the study to prove that vitamin C was a waste of people's time. He wanted to protect people so you would stop having false hope. He did this study to prove how useless it was. And now that he's got all these studies, and he's got a ton of data, they tell him vitamin C is too toxic to test in humans. We'll go on treating them with Avastin, which has never been shown to make any benefit in any patient, but the company gets the 88,000. So they get 88,000 to give your wife with breast cancer Avastin without a single document that it helps anything. So the system is a little bit out of control. So high doses of vitamin C, this again, United States Department of Human Health, this is high doses, can fight cancer, at least in the laboratory researchers report. They took another look at it. So high-dose C is becoming more widely employed as oxidative therapy for serious things from hepatitis. ACAM offers courses on teaching this. And so there are many places now, because there's a lot to the details. And if you add that, what the 3 things I would do intravenously on anybody would be my short chelation, 5 minutes, calcium EDTA. That replaces the 3-hour treatment that we treated 10 million people with. The 10 million one is the one we're still doing with the NIH, but that's yesterday's medicine. The IV nutrient that Alan Gaby has really done a great job making the Myers widely known: magnesium chloride, calcium, vitamin B12, B6, B5, B complex, vitamin C, sterile water. This changes people's lives. It happens that at Johns Hopkins, there was a doctor by the name of John Myers. And there was a doctor by the name of James Pershing Isaacs. James Pershing Isaacs at Hopkins became one of the first ones to develop the heart-lung machine. He was in the Department of Cardiovascular Research, Cardiovascular Surgery. He became one of my many mentors. His research was on trace elements. He showed that he could take patients who were inoperable with heart disease, and by giving amberlite resin, which was a form of a chelator, along with trace minerals, along with low doses of hormonal therapy, he could avoid death in advanced cases, and the control group was all dying. And nobody at Hopkins ever asked him to present the paper. So he's a world-class expert on trace minerals. And down the hall from him, less than 5 doors down the hall, is John Myers. And he's a world-class guy that came up with the Myers cocktail using intravenous magnesium and nutrients. The 2 of them had a falling out and never would speak to each other. 2 of the top people in the whole world on trace elements in the same institution, and that institution never invites them, either of them, to speak about their research at Hopkins, because it can't be patented, can it? Everything I'm telling you about is so sad. So these are things that can respond to intravenous nutrients, and there's a reason for these many things happening. I don't care if you're talking about better athletic performance or getting off narcotics. I don't care if you're talking about depression, asthma, because these nutrients, the need for them soars. Just like you can't have all the mercury when every time you breathe you're getting mercury in the particulates and lead, because it's in the air. That's why the oceans are all loaded with mercury. That's why every fish. So when you breathe, if you don't take enough selenium to offset that mercury, you don't have enough glutathione to live to your maximum intended useful lifespan. So I'm here as a spokesman for what I would call infinite wellness. And you won't achieve it without learning a lot of these things, because there are many factors against it. Now, vitamin C has dramatic antiviral activity. It works at very high concentrations best. Magnesium, which I've been a member of the Magnesium Research Society, and I'm a member of the American College of Nutrition. The director of the American College of Nutrition, Mildred Seelig, wrote the book Magnesium Deficiency and the Pathogenesis of Disease, and if you read the book, you would never treat anybody without magnesium, because you know that if they're sick, the person doesn't have enough magnesium inside the cell. Don't rely on serum tests to learn this. High-dose vitamin C, New Zealand. This was actually covered dramatically on television in New Zealand. You're not going to see it in America, of course. We don't want anybody to know that anybody ever fought against the system. This is the man who'd been 22 days in coma with every instrument tied to him, and they came to the family and said, let's pull the plug. No sense of wasting any more time. Dad's dead. He's completely on 100% life support. And they said, no, we want Dad to have some vitamin C. They gave 100 grams, and that lung that had stayed opaque, the lung was 100% filled with fluid for those 23 days, started to clear out. So they had to fight, of course. It's a long story. Please go to my website and please watch the story, because you'll save lives. But you'll have to learn, you fight in this life. Because once he started getting well, they stopped giving the vitamin C again. And he started immediately deteriorating. You have to fight. You need to know the story. There's no simple way. So Tom Levy, my friend, is an attorney and a cardiologist, and he wrote the book with 1,200 references. This book alone, if you read this carefully, line by line, you will never be worried about toxins or lack of vaccination or any infectious diseases. You will know that we have the answers. The trouble is to understand it's never going to be done in the way that we give it in this country, which is such a fraction of what the body needs. When you're living on a toxic planet, the need for C goes so high. In this book, these are two PhDs, and they've actually issued a challenge to the board that establishes the RDA to tell them how full of hot air they are, to continue lying to the public that the only amount of C that you need is 60 milligrams, because they're guaranteeing keeping the whole population sick. Very sick, because you can't have 1,000 times too much lead in your bone when you're born. And now Harvard finds that the lead in your bone is in equilibrium with your eye, which means it's with your brain, which means it's in your heart, your kidney, your liver, which is why my chelation made me, after the 8th treatment, I got the lead out of all of those tissues. So my heart was working, my liver was working, my kidney was working. But I hadn't cured anything, and that's what the ACAM doctors have difficulty expressing to their patients. If you take 30, 40, 50, 100 chelation, absolutely you look different, you feel different, there's no question. But you haven't cured anything, because they stopped the treatment because they've been told all too frequently by doctors who seem to feel a little challenged by sharing the fact that oral chelation works, because the patient's going to say, well, if it works, why would I spend the money for IV? Well, it's simple. You spend the money for IV because if you wash your car, does it look the same as when you have a professional whack job done? If a deep cleansing makes your car look better, would there be anything wrong with doing a deep cleansing of your body and do it IV for 10 or 20? It's that simple. So once we get that story out, but it is a need then for lifetime, because you can't stop breathing, and when you breathe you can't help take in more lead and mercury. It is proven in every research paper by Archives of Environmental, by EPA. It's in the air. If you thought you had clean water, forget it, you don't. If you thought your shower was clean, no, who are you kidding? There's no shower filter that'll work after the first 3 times. It's all a joke. And if you think your bottled water is protecting you, they've done nothing to actually prove that they've treated more than 40% of them. So yeah, it's a tough thing, but these guys really have the data to prove what a completely greedy world it is. If you read this book, you would know how you've been absolutely sandbagged, and if you don't stay on 10 grams of vitamin C every day, I assure you, you will never reach your maximum intended useful lifespan, period. And there's no way you can challenge me, because I've got the data. So this is all I'm trying to say. You want to have a bright future, you want to have a bright spot on the little test. The stick is green, and you want that green. When you pee on it, you want it to be yellow. If you stay here, you will not respond to any homeopathic, you will not respond to prayer, you will not respond, because this is what we used to call scurvy. This means you have no antioxidant to combat today's huge levels of oxidant, stressor, toxins in our body. So if you stay there, nobody responds. It's documented, but you stay here. This is why the Reardon Clinic has everybody get the stick and has everybody test themselves at least once a week, and they take the sticks home and test their family. 14% of all people that we test in Canada come out with this color, meaning they're wasting their time with whatever they're seeing because they have a proven, serious nutritional deficiency. So the Linus Pauling Institute is really where we've tried to save this knowledge. That's how Jeff Bland started his career, working right there with Linus. And I met with Linus because Linus Pauling gave us a group of doctors the name orthomolecular medicine. And so I have been both an orthomolecular medical doctor since we formed it with Dr. Linus Pauling's input, and then I've been an orthomolecular psychiatrist, in which I've learned that when the patient is not in a brain fog, psychotherapy really works. But if the patient is in a deep fog, psychotherapy is a joke. And until you learn how to detox the body and give it the nutrients, psychotherapy is a virtual waste of time, in my humble opinion. But vitamin A deficiency and infectious disease, it is a major problem. If we look at the liver that we test in anybody that gets killed by accident in our country, 21-year-old gets killed in a motorcycle. I used to do emergency work in Sacramento. We had an average of 2 dead bodies every 8-hour shift. So we were brought all the accidents. And if we would take that liver of anybody that's suddenly dead, you know, in polar bears have a lot of vitamin A in their liver. Our people, our youngsters, have almost no A because our diet isn't giving it. Yet nobody knows this. It's an overwhelming deficiency, and the problem is that you have to learn functional medicine or you'll do the wrong test and you won't know what to do. So if you have a low level of A, it's going to make your Lyme much worse. So that's why I say it's L-I-M-E-S disease. We don't want to spend all our time saying, I'm just going to put the patient on IV antibiotics for 6 months, we'll have an indwelling fluffer, and maybe in 6 months they'll be a little bit better. What hogwash? Treat the entire body, FIGHT, or use Mark Hyman's approach, 7 keys to survival, but understand we've got to treat the whole body. And vitamin A is so simple. Anybody. It's cheap. You can get a drop that has 10,000 units if you just shop around. And if you give people 50 drops, they got 500,000 units. And 1 out of 100 might have a headache for a day or two. And meanwhile, you fill the tank. But how do you fill the tank on iodine that we all need? How do you fill the tank on magnesium that we all need? How do you fill your tank on B complex? How do you know how much B6 you need? Have you had all the genetic testing that Bruce Ames talks about? Bruce Ames is a big name. He's one of the leading biochemists of our time. The Ames Research Laboratory, University of California, Berkeley, we'll get into more. Vitamin D, the kids are so leveled that rickets is coming back with a vengeance. That's what mainly makes me concerned, that I don't like to have to do everything by vein because it's expensive. I prefer to do things by mouth, but it's just to warn everybody that just because the patient comes in and says, I'm taking 5,000 units of D, I couldn't need more D, doc. They could be dead wrong. Their level could still be as low as 30. And that's not optimal at all. So just because they're taking it doesn't mean anything really is happening. So please learn that I prefer to put my patients on a program first that does something for the F and the I and the G and the H and the second H, that's hormones, heavy metal, and toxin. I prefer to do it that way. And then I prefer, if they're not doing well, to then spend the money on the tests, because nobody has unlimited finances, and these tests are not usually going to be covered by insurance, because it's not considered usual, customary, reasonable to even care how much mercury comes out when I give you a provocative test, or how much mercury you find in your hair. If you read the book, Diagnosis Mercury by Hightower, you'll become an expert on this. She was head of internal medicine at UC San Francisco, and she started seeing all the complicated patients that no one else could help. And she started ordering blood mercury on all these people. And she found out that they, in San Francisco, was very in to eat fish every day. And she had all these weird symptom patients, wrote a book called Diagnosing Mercury that would really open your mind, because now you'll see how corrupt our government is. Because they're trying to be at a medical school, diagnosing mercury. She didn't want to get in a fight with everybody, so she thought she'd ask a simple, innocent question. FDA, what's a safe level of mercury in people? Took a long time to get an answer. She asked EPA, and the answer came back right away. Then she looked at the answer when she finally had them, and this was a magnitude of order greater than it was by EPA. How could two government agencies have such a disparity of opinion about what's safe in mercury? Is it because somebody has got a conflict of interest, possibly? Just raise your peak, because the world is complicated. So D for dilemma. We have the same thing now going on. In Canada, they're now saying we need vitamin D. In our country, the Institute of Medicine just come out and say it's all hogwash, you don't have to think about it. So isn't it astonishing that across one border, suddenly we need vitamin D. All you have to do is just get north of that border, just go across the state. But in our country, we're being told it's not. So there's a lot of conflict in medicine, which is why it's so sad they lie to everybody about autism, and they refuse to admit that there is a clear-cut relationship with these illnesses and asthma and all these other things. In fact, they're having trouble. So the vitamin D prescription is a good book. They'll give you a little bit. There's so much to know about every single thing. Now, since I'm an anti-aging medicine, we want to make sure that all of you know that garlic has done a lot of good things. Vitamin K of the 2 has made it so I don't have to do the 3-hour chelation anymore. I can have everybody get chelation in 5 minutes, and the 5 minutes gets more lead out than my old treatment that I used on 10 million people. And now it's quicker, easier, and many doctors don't have to have a lot of chairs and a lot of nurses. 3 minutes in the chair, go on your way, and take another 3 minutes and do a Myers. You do 2 things. The doctor earns the same income, and the patient feels fantastic and hasn't lost half a day at work. So, omega-3, I wrote the book, The Omega-3 Miracle. You can't live without that. Green tea is changing lives. Pistachio nuts cut down cancer risk. Broccoli is clearly doing many positive things, even though our first President Bush said, I'm president of the country and I don't have to eat broccoli. He's still doing pretty good for 90, but he would be doing even better if he'd been on his broccoli. Curcumin, if you listen to Bharat Agrawal, who's the head of experimental therapeutics at a little place called MD Anderson. Now, being as hell as an MD PhD, nobody listens to him because, you know, he just will tell you that he has written all the books telling you this book that he's written, Molecular Target and Therapeutic Use of Curcumin. When you become an expert on this, you would wonder how anybody could practice medicine without learning this story. But it's the tip of the iceberg, because remember, he's from India, so he kind of understands all of the Ayurvedic medicine. And Ayurvedic medicine, like Chinese medicine, there's a great deal of truth in American herbal medicine and teasing out of all these things. But when you understand that, you know, when I met with him, essentially he told me that what we're doing at MD Anderson, he said the drugs we're giving are a fraction of the benefit to the patient of any other things that are in his books, which all are affordable, all can be taken orally, and all have a minimum of side effects. But it fits the system. We've got to keep killing people off after all. You know, we have too much population, so since arguably medicine is either the 4th leading cause of death, or if you believe Gary Null and I, medicine is the leading cause of death. By the way, if you think that's a joke, in England we've had 2 incidences where the doctors have gone on strike. And it's been well documented in their newspapers. Death rates plummeted, and this is no accident. I am not making this up. Please learn your history. There is no question. When the doctors couldn't write the prescriptions and couldn't do the operation, people stopped dying. In fact, it's a joke. The funeral parlor said it's the only time they ever get a chance to have a holiday is when the doctors go on strike, because there wasn't dead bodies to deal with. So it's kind of interesting. So the more you learn about curcumin and spicing up the immune system, this was an excellent book. Was really thinking. Michael Schmidt is one of the thinkers of our time, who says you're not going to blow out all these infections and pathogens. You're going to have to learn how to have some peace, how to have you healthy enough so that you speed recovery and minimize or avoid the use of antibiotics. That's what my FIGHD is about. And here's a very learned man with a very good book trying to have you understand this. And now we're going to take another break. We'll be back with genetics in a moment.